I have two really exceptional women. They are both leadership from the Headstrong Project, whom I've had the privilege of getting to know more about their work as we go along. I have with me Lora Dircz. Am I saying your last name correctly, Laura?
Yep.
Great. She brings the marketing wheel to Headstrong, and with her is her leadership colleague, the amazing Dr. Amy Williams. She's been a VA professional for over 20 years. She's recently joined the Headstrong Project leadership team as their chief clinical officer. So, Amy, could you talk a little bit about, it's not a cookie cutter thing for everybody therapy wise?
No, not at all. So it's always challenging because we're trying at one hand to do research and know what are the best approaches, but everybody is really individual. And if you think about the research with post-traumatic stress and the treatment of it, it really only goes back to maybe the 80s or so. And the treatment research is even more recent. That's more like 90s, early 2000s. But what we've come to settle on as a field in psychology are that there are three kind of frontline approaches: eye movement, EMDR. So eye movement, desensitization, and reprocessing. Let me not mess that one up. Everybody just calls it EMDR for that very reason. It's got a long name. Cognitive processing therapy that I've already talked about, and prolonged exposure therapy. And our therapists at Headstrong do all three. Now, if those are the frontline treatments, does that mean that they work for everyone? No. Our biggest issue actually oftentimes is dropout. People, like, it's hard work to do. In post-traumatic stress, as part of the diagnosis, you have to want to avoid thinking and talking about the trauma. And then what are we trying to do with people? We're asking them to do the one thing that in order to even get the diagnosis, they have to want to avoid it. But yet we're like, okay, but we're not going to avoid it, which is what the treatment is. All three of those treatments really work with the person that's suffering to not avoid. And that's the commonality. They all have kind of different approaches. And we know medication has a place, but we also know that therapy is more effective. And then there have been other types of approaches that people are researching and trying, all kinds of things. But at this point, most of the research and the evidence that we have shows that people do the best with those talk therapies. But there are all kinds of efforts in the field to figure out who do they work, which one works for whom the best, and then how do we retain people? So some of the more recent, I think, exciting parts in the literature that are happening right now in research is we're trying to do the treatments in a shorter span of time. So it used to be, we would say come in once a week or twice a week, and and that takes a few months because most of the treatments are around 12, 15 sessions that I'm talking about. But now we're wondering, what happens if we combine that and collapse it into a shorter period? We call it mass dosing. So you're getting a bigger dose in 1 to 2 weeks, which sometimes people are like, yes, I can commit to 1 to 2 weeks easier than 3 months. And so there's some really exciting research coming out about what is the best way to do these treatments so that we can engage people and get people better.
Yeah, and I would love to just, I'm curious to know from both of you, from both of your perspectives and the work that you're doing, the philosophy is that, or I've come to understand that we can heal, we can recover from the invisible, from trauma, from those injuries. Our brains can come, our central nervous systems can calm, our brains can settle a little bit more. We can, as you just said, lean into what happened without, suffering it. So I would love to hear from you both your thoughts about the positive aspect of, if you get treatment, you can get better. Mm-hmm. Is that, where are you both with that, and what's your experience with Headstrong on that? Laura, how about it?
Yeah, I can start. And this is, from some of the conversations that I've had with some previous clients of ours too. It's been so interesting to be able to hear, their individual stories, because first, you have to recognize that there's a wound to be able to heal it. And so exactly what Amy has been saying. And I love the idea of, it's almost like this immersive therapy, if you're going through it and, you can power through those 2 weeks and really get to the, the source of the trauma, because a lot of clients, previous clients that we had that I have spoken with, it took them a while to get there, and then when you uncover other things as you're going through therapy, I mean, it's something like we all could use, I think, at the end of the day. And it's like the stigma, not just only with our veteran community, but just in society in general, is that it's okay to not be okay is becoming like the catchphrase of, 2020, 2021, since the pandemic had hit. And a lot of people are focusing a lot more on their mental health and saying, wait, this is something, it's the mind-body connection. With my background of, sports psychology, it was finding that connection. So now I can take some of that. And then when I have these conversations with, some of our veteran community, it's, they have, there's such strength in these people, such courage, such strength, and such bravery that they don't want to look weak in any way. And by saying, I had experienced mental trauma, or I had sexual trauma, or I've had, any kind of anxiety, it almost is like a dark spot on them. And they feel that it's a negative effect. Or at the end of the day, we're all scarred. We all have our wounds, but it's recognizing it first and saying, I am hurt, I'm wounded, and it's okay to ask for help.
Right. Well said. I spoke with a Navy mineman the other day, and he had a traumatic brain injury. I mean, his frontal cortex, they could see it on an X-ray, was injured. These are real injuries in these extreme situations while he was in the Arabian Sea on ship. And he didn't understand what the repercussions of that traumatic brain injury would be afterward. The PTSD, the anxiety, your brain is rattled. There's an injury there. So it's this more understanding of that. And as you just said, less stigma around the idea that this is a sign of weakness. These are injuries. So Amy, what's your thought on the you can heal, you can get better. I mean, you just said mass treatment, the excitement about that and the response. How has that been with your patients?
So to Laura's point, the research tells us, and also just anecdotally, I can tell you in working with people try to do this on their own for a while. People don't go through a traumatic event and then run to a therapist. That's just not what people do. In anything, not just in a traumatic event, but if you think about like people, your own kind of, you're going to try all your own stuff first. Like, okay, I can get this, I'm going to work through this. And so by the time people come to us, a lot of times it's been a while. It's been a while since the trauma, and they've been hurting for a while. Yeah. And that, when I know that like there are effective treatments that we can help you get better, like that you don't have to suffer, it like hurts my soul that people are out there struggling without getting help. And so I think that message that we can't make you forget what happened. And I think I've had people actually tell me like, my goal is to like erase this. I'm like, can't do it without a lobotomy. Like I cannot erase a memory. But what happens is you look at it differently. So if you think about like a death that you've had, at first when you lose somebody, it's very powerful. Like, you cry, you can't stop thinking about it. It's like there all the time. And it actually gets in the way of remembering the good things about the person, like your grief, right? Trauma works the same way. If you can process that, if you can kind of move forward, what it looks like is you still know it happened, but you're able to see it in a bigger light. It doesn't cripple you the second that you're triggered. You're like, yes, that happened. I'll never be happy about it, but I can live my life and move and have an enriched life. And that's what it looks like. So when people heal, we're not taking something away. They are forever changed. But we talk about post-traumatic growth is also a phenomenon that we see. Sometimes it actually helps people to have a greater meaning in their life, to be more appreciative of their life. And so that's what's on the other side is, to be able to enjoy things again and be able to live your life and not be limited by what happened to you.
Everybody, as we've seen, is going through issues right now during the pandemic and feeling the mental strain. And, being in isolation for 18 plus months will make anybody stop and think.